Fundamentally, I want the healthcare system to proactively try and engage people in health, in their care, and ensure that they have the support they need. And so when I think about navigating this system, it's just confusing. Whenever I've been in a moment of emergency and stress, and I'm someone who works in healthcare, but I panic somewhat. And I'm like, well, I don't know what to do now. Do I go to the emergency room? Is there an urgent care I go to? I went to the urgent care and they actually don't do stitches here anymore. So then I had to go to the emergency room. Like that was a literal thing that happened to me where I'm like, why am I sitting in the emergency room waiting to be stitched up? Because I couldn't find anyone else to handle this. And more serious things with loved ones where we've had to navigate stress is something that could be life threatening. It's hard. So I want to have a healthcare system where people have support in the moments of need and have help navigating it, where people are engaged in the time between visits and not just, oh, well, here's my 21 minute increment that I will bill for, and therefore I will engage with you right now in this moment and not worry about you once you walk out the door. And so changing that so that we have a proactive system that tries to engage people would be my first and foremost goal. It also needs to be one where the care itself is affordable. And we have a system where, just given productivity growth that we've seen in this country in other fields, that we have not seen matched in healthcare to the same extent, care has gotten more expensive because it's labor linked, right? The staffing ratios of how many patients each nurse can handle have not changed drastically this century, nor would we want them to. But if we could get engagement earlier, and if we could support people with agentic solutions and with new drugs so that avoid the need for the hospitalizations, that will unlock productivity. And so encouraging investment in technologies, encouraging investment in new drugs, I think can enhance the quality of care that we experience in a way that is deflationary over time. And so I think affordability, in addition to the proactive nature, is an important thing to have front and center. And then if I was to name a third thing beyond a proactive system that engaged me and gives me affordable care, is I think it needs to be one that has restored trust in the American people, in the system. People need to know that they're getting real information, that they are in control, and that they can rely on it.